All right, so good afternoon. Excuse my voice, I'm just a little bit under the weather. And thank you, Dr. Juwayriya, for this invitation. So following on from Dr. Khadija's talk, which really comprehensively covered diabetes and metabolic disease, we'll move on to a condition, a chronic disease as well, obesity, which encompasses many complications which happen to be other diseases. So obesity is linked to a greater chance of developing diabetes, is linked to a greater chance of developing cardiovascular disease, and it is quite an expansive consultation to have. And just to mention as well, this conference, I think is amazing to hear all the talks. For me, this is a very personal topic. Dr. Juwayriya is away. So as a teenager, I lost my mother to myocardial infarction at a young age. So she was 50 years old. And in those days, we are still not there yet, but in those days, there was even far less information on how symptoms can be atypical in women and how it's clearer to us that there are many things we can improve on. These are my disclosures. So what is obesity to start with? Because I think despite the fact that it's a common condition, we have different definitions of what it really means. So the World Health Organization had defined it as abnormal or excessive fat that may impair health. Now the suggestion, the word may is maybe and maybe not, okay? Now, if we move on, and they classified it by body mass index, so BMI, and you can have overweight, which is between 25 and 30, and then class 1 obesity, class 2, and class 3, which is over 40. Now, we know that those cutoffs are also slightly different based on your ethnicity, and there is a lower cutoff for the Middle East region. Now, the Lancet Commission, which Dr. Khadija alluded to earlier, just this year in 2025, came out just to re-emphasize again that obesity is a chronic disease. That wording was missing from the WHO definition. So they re-emphasized that it's a chronic disease, and they defined it as excessive adiposity with or without abnormal distribution or function of adipose tissue, because there are more than 200 complications, potential complications of obesity. We may be familiar with some of them, which are the metabolic conditions, and maybe some of the mechanical conditions such as arthritis and hernias, as well as the mental illness. However, there are preclinical phases where you could be at, so you could be on your way towards a complication, which is very likely given the sheer number of possible complications. Prevalence similar to the way diabetes is, but probably even more prevalent. Around the world, it's a global issue. And if you look in the dark navy shade, you could see the regions where this is more of a problem. So probably closer to more than 30% of individuals, this is both male and female, would have obesity. And you're looking at the United States and you're looking at the Middle East as well as some of the Pacific Islands. Now, looking at the United Arab Emirates specifically, on the far right, you could see, so the gray areas showing overall overweight, prevalence of overweight. You could see in the UAE, it's actually approaching 60% of people who have overweight. It's just a little bit less than 60%. And in women, you can find that obesity is more prevalent than men. So it's close to 25%. This was a study done across Dubai. It was a household survey in 2019. However, we do have another study done by the Ministry of Health, which actually put the number at 36% of obesity in women and 27% in men. So there is a discrepancy with a higher likelihood of women experiencing this. The trajectory doesn't look good because based on the World Obesity Federation, it's estimated that at least 30 countries worldwide are going to have a combination of overweight and obesity exceeding 88% of their population in both adults and children by the year 2060. Now, 11, so a third of those countries are in the Middle East. Fortunately, the UAE isn't there, but it's not that they're doing any better. They're going to be somewhere between 80 and 80%, 88%. So why is obesity an issue? Why should we address this in both men and women? So as I mentioned, we can classify the many complications into metabolic, mechanical, and psychosocial or mental. And the metabolic conditions tied really to insulin resistance, diabetes, pro-inflammatory conditions, cardiovascular disease, fatty liver, and polycystic ovarian syndrome. The mechanical are more related to the weight, such as arthritis, reflux, edema, and it's associated with a reduced quality of life. This is a spectrum, so not everyone goes overnight into one of the complications of obesity. It builds over time. You start with the insulin, for the metabolic disease at least, you start with insulin resistance, and you can progress to type 2 diabetes, and with type 2, again, you can progress to the end organ damage. And we have the Edmonton Obesity Staging System. This is a tool that's been around for a while, which we can use to help us treat our patients with obesity, because it helps you stratify them not just by BMI, but by the actual disease conditions that they have and how severe those conditions are. Now, it's challenging to address obesity, and many people have differing opinions. It's because it's multifactorial. So you have genetic conditions, epigenetic conditions, psychosocial diseases, medications that are going to aggravate the situation or lead to the situation. And in the Gulf specifically, because we have a high prevalence of obesity, and it's specifically more prevalent in several areas, including Latin America, Africa, and the Gulf, but this discrepancy is more notable. And there was this review that explored some of the potential reasons for that. And some of the main points highlighted were socio-cultural constraints, so limited access to women-only gyms, clothing, weather, outdoor spaces, cultural discouragement of public exercise. And actually in my clinic sometimes when I see women, especially Emirati women, I have this conversation with them about exercise, and I ask them, have you ever exercised outdoor? Okay, if you don't like to exercise indoor or a gym. And strangely enough, a very common answer I get is, no, that's only for foreigners. So I don't go outdoors. I'm not going to go out on the street to run. So it's actually culturally not acceptable to several people, maybe due to clothing, due to the weather. The life stages, so yes, polycystic ovarian syndrome is common with obesity. However, the incidence of polycystic ovarian syndrome is also quite high in the Gulf states, approaching up to 20% in some countries. It's a little bit less in the UAE. The caregiver burden, so yes, they dedicate their lives maybe to their family, and the extra responsibility and anxiety related to that, as well as the dietary patterns. We had a huge shift in the type of food we have and the movement as well, especially in the Gulf states. And you could look at these figures from the World Obesity Federation, looking at Middle Eastern countries in general, and you could see the UAE, this is from 2022, women have the least amount of physical activity. Now, obesity across a woman's life course, so women go through unique hormonal changes, not only throughout their lifetime, so before and after menopause and while they go through puberty and pregnancy, but also monthly during their menstrual cycle. This can impact obesity for reasons we'll discuss, and women are also more likely to have autoimmune disease, and this can also impact their weight, especially if they have underlying hormonal disorders such as thyroid disease, which is 4 times more prevalent in women compared to men, as well as arthritis, and they have limited mobility and pain. Now, in the menstrual cycle, The luteal phase is probably the phase where there's an increase in appetite and food cravings, and this is usually due to a rise in progesterone, a drop in serotonin and leptin, and a rise in ghrelin, which is a hunger hormone, and this acts on the hedonic centers in the brain. This leads to a premenstrual phase where there's increased cravings for carbohydrates, for sugary foods, and it is a struggle for many of the patients who are trying to control their diet to go through this, because they really do feel it's out of their control, and they, to be honest, they have a good reason for it. Other complications related specifically to women and more concerning in women as a complication of obesity, metabolic disease, Dr. Khadija spoke about, and type 2 diabetes and fatty liver and cardiovascular disease. It can impact their fertility regardless of the presence of metabolic disease, but obesity can impact fertility. Women have more of a risk of having micronutrient deficiencies such as iron deficiency because of having their menstrual cycle and menorrhagia. So this can complicate, this can lead to fatigue. They're more likely to get fatigue and move less, and it can also complicate post-bariatric surgery. There are obesity-related cancers, which are highlighted in the image, among which is breast cancer, ovarian cancer, and endometrial cancer, which are associated with obesity. They're hormone-dependent in some cases, and these women who do have cancer, in my clinical practice in the hospital I work at, there's a very large oncology center, and many of my patients who come to me with obesity, they actually have cancer. They have breast cancer, they're undergoing chemo, they're on medications for that, and it's really quite a challenge for them. Venous thromboembolism, so women are more likely to get a pulmonary embolism or a DVT if they're on oral contraceptive pill, and also if they're pregnant. And if you add obesity to that, that increases their risk further. Same goes for hormone replacement therapy. They're more likely to get incontinence, urinary incontinence, pregnancy complications, and menopause we'll discuss, as well as mental health. And the graph there just shows the prevalence of polycystic ovarian syndrome in the UAE. And just look at the way it's rising. That just highlights the 2 years post-COVID. So that's from 2020 to 2022. With the weight gain and less movement, more food, there was a doubling in the prevalence of PCOS during that time frame. Obesity leads to more complications in pregnancy, including gestational diabetes, preeclampsia, complicated deliveries, stillbirth, and long-term issues in the offspring as well. Another challenge is many women can't take obesity pharmacotherapy during pregnancy. It's contraindicated, so it becomes more of a challenge. They lose weight before pregnancy, have to stop, and then they regain it during and after pregnancy while breastfeeding. Now, some of the hormonal changes occurring in menopause, so there's less estrogen in women who have obesity, although paradoxically it's higher post-menopause, but this worsens the lipid profile and insulin sensitivity. Women with obesity are more likely to get early menopause, but that's also true for women who are underweight. So it's like a J-shaped curve you could see there. So more likely to get early menopause if you're underweight or overweight. And in a meta-analysis, they showed that there's also reduced anti-Mullerian hormones. So they're less fertile, and there's less ovarian reserve in women with obesity. Other symptoms, vasomotor symptoms, conflicting data, but it tends to support more intense hot flashes. There's no increase in osteoporosis, but they still have a slightly increased fracture risk. They have more genitourinary symptoms, and we discussed the risk of VTE with hormone replacement therapy. Mental health, women are more likely to suffer with depression, especially if they have obesity. They are more prone to body image ideals, especially from social media and misinformation. And there is a stigma. So there was a consensus statement addressing stigma, and you could see that women are more likely to suffer weight-based discrimination compared to men. This has the potential to contribute to inequalities in employment and in education. So counseling strategies for them avoid the bias, the stigma, including stigma in the use of drugs. So there's no such thing as cheating by using a drug or taking the easy way out. Unfortunately, women are subjected to this, men as well. Use inclusive language, be aware of cultural issues, and try to address health issues. So you can have lifestyle modifications, caloric restriction. This has been used in PCOS, sometimes successful, sometimes not. So you have to be aware of people who need other treatments. Digital health is helpful. Noom is an app that has been available for a while that uses cognitive behavioral therapy to help address diet issues. Obesity pharmacotherapy is a tool available to some people, and we have studies on liraglutide, semaglutide, tirzepatide for weight loss showing their efficacy up to 25% with tirzepatide. And this meta-analysis on 2,000 patients showed improvement in depression scores, also improvement in symptoms of PCOS using GLP-1. This was a study we did at our center in Mediclinic, real-world study on tirzepatide, and interestingly, the best cohort, the best group we had who lost the most weight were women with PCOS. We don't know why this is the case. Yes, less of them had type 2, they were more pre-diabetes, but it may be the motivation for fertility, but they do well with treatment, so we should not deny them this. They also tend to reach a weight plateau slower than men, so they do well on these drugs. They can continue losing weight for a longer time compared to men. This is based on post-hoc analysis from SURMOUNT trials. They do lose weight equally, whether they're in premenopause, perimenopause, or postmenopause. And again, this was from analysis from the SURMOUNT program on tirzepatide. So there's no such thing as I can't lose because I'm perimenopause or I'm not 20 anymore. I think it's my age. So I have people coming to clinic who are 30 years old and telling me that I think, I'm old now and my metabolism has slowed down. They also lose more weight in the heart failure trials, although they're more symptomatic. Bariatric surgery, last point in terms of treatment. So the Bambini multi-center randomized control trial looked at bariatric surgery in improving symptoms of polycystic ovarian syndrome in women with obesity. And you could see that they had better ovulatory cycles and more weight loss, obviously, which we believe is the reason for this. So in summary, obesity is common in women. It has unique cultural, biological, and psychosocial factors. All healthcare professionals, not just endocrinologists or obesity physicians, can play a pivotal role in screening for complications and treatment. Lifestyle measures and empathetic counseling are crucial, but pharmacotherapy and surgery may be required and should not be overlooked. Treating obesity in women is not cosmetic. It's life-saving. Thank you.